You were recently awarded a $3.8 million grant from the National Institute of Health / National Institute of Nursing Research. So first and foremost, congratulations on that.
Thank you.
Can you talk a little bit about the grant and what the grant is for and how you see your research shedding light on the purposes of the grant?
Absolutely, yes. So it really is an honor and a privilege, as Dr. Williams said, to get to design and lead these studies to produce real data towards maybe moving things in a direction that we feel and theoretically makes sense that it should go. But we need to know, does it work? Does it work for everyone? Is it equitable? Is it scalable? Is it sustainable? So as you might imagine, there's a lot of complexity to that. And so really everything that I do focuses on the prevention of death in babies, so infants and in moms. So this project is something I'm super passionate about. It's through a collaboration with the College of Medicine and really trying to take the great work that they've done to the next level by incorporating science and nursing science and getting everyone around the table to provide their perspective. So what we're actually focusing on is care of mom and baby after a complicated pregnancy, which to your point is so important and unfortunately often neglected. And so what tends to happen with mom is all of the energy goes to baby and family, which is fantastic. But we also know that mom needs really good care and support during that year. And a lot of deaths to moms are actually occurring not necessarily in the hospital, but after they go home. So day 7 to day 365 after they go home. And so that's really our target. So we're testing 2 models of care. It's a randomized controlled trial. We're able to do this across the Central Ohio region at 14 different sites. We've got our control condition, so we can say, okay, this is typically how care would progress. We've got our intervention that we're going to test simultaneously that really takes a deep dive into how do we schedule patients, how do providers communicate with each other, how does the obstetric history, so things that happen during pregnancy, inform primary care so that we can follow up in the best way, and then probably most importantly, how do we integrate clinical and supportive care. So this is where working with the community, knowing those resources, having these close relationships with something like an academic medical center and all of these great programs out there in the community can be so important. So we're super excited to be testing this over several years, several hundred dyads, mom and baby dyads, to say, does this work like we think it should work, and how do we make it better, and how do we get it out there? So what an opportunity. I'm just honored to be a part of it, really.
Congratulations. It is an incredible opportunity. A few follow-up questions to that. How would you articulate the solution that is being terminalized or that you are working towards identifying? Would this be largely associated with postpartum care, and would you call it a postpartum care model?
Absolutely, yes. So technically it would be considered postpartum primary care.
Okay.
So it's how do we transition out of that period of pregnancy, understanding what happened in that pregnancy to really help mom be healthy and prevent her from developing complications or even, like I said, dying during that postpartum year. So yeah, absolutely. It's a model of care. And what's really cool about it is we're thinking critically about how we care for mom and baby together.
Yes.
So that they can be present and get the care that not only baby needs, that would typically be given by a pediatrician, but baby and mom together. So that's the exciting aspect of it.
That is very exciting, and just sometimes even that can be separate. So what I like is that you mentioned that it's together. Even sometimes it can be something simple. Sometimes babies have to go to the NICU and mothers have to go home. And so being that you're conducting this research, it's very sentimental and significant that you're doing this. What does when you're doing all of the research that you're doing, what does your day-to-day look like when you are working on this every day?
Well, I share an office with Dr. Jansura, so she sees this in action. There are so many details, I think, that nobody even thinks about. You can even go through an entire PhD program and not know about all of the components of your job until you're out there and doing it. And so it keeps it exciting. It's also super complex. Things are evolving, moving very quickly, and often we're trying to really push several lines of work that we're simultaneously passionate about forward and taking care of everybody. So I think that is the perhaps the skill of a nurse scientist is just to wear many hats and wear them all just as well, because we care so much about all of them. But yeah, hectic and rewarding.
Okay.
That's how I would summarize it. Yeah.
So hectic and rewarding, and you also mentioned that there's lots of details. You also mentioned you are an educator and a nurse scientist. So for you, because you're doing so much, how do you find balance while keeping the overarching goal of improving and impacting maternal health? How do you do that?
Yeah, absolutely. Well, that's a great question. I first just want to say, and this is often because I wish people had said this to me when I was kind of going through this process, but it's not a matter of, you can't do it all or you can do it all. It really is all about balance. So even things like being there for your family, leading a good and honorable profession, work life, being there for your colleagues, all of that can happen. You just have to kind of lean into your strengths and into your passions. So balance, as you said, is key. This includes, being there for students, leading this program of research, making sure that these models of care are getting out to patients and families. Luckily, I guess I knew I was gonna have to find balance eventually, because my training is also very what they call transdisciplinary. So what I do is kind of bringing these different worlds together in new ways, which is oftentimes kind of what we need. We need people in different professions to bring their perspective in, and I think of myself kind of as that translator right in the middle, that I kind of speak the language of various things, and I think that really helps. So for example, my background is in psychology, and then I went on to get my nursing degree and master's and PhD in nursing. Yeah. Well, it at the time seemed like a little bit of a windy road, but now I'm really glad that I did it, because a lot of that background in psychology and just understanding that what we're experiencing very much gets under our skin. It affects our health in very real ways, and oftentimes ways that we can't quantify, and it's hard to describe, but I do really try to bring that to everything that I do, working with students, pushing them, but also being supportive, mentoring students so that they see, hey, I have a dream, this has happened in my life, so I can bring some good out of that by pursuing that dream. It's all kind of interrelated in a very strange way, but in a very good way. So that's always my goal, is to balance, combine, bring together to support people in their dreams.
You've said a lot of insightful things just now. I really appreciate you mentioning how it's important to lean into your strengths. I also acknowledge the fact that you did say that sometimes stuff can just really get under our skin. And it could just be true that no matter how often we try to balance, it can truly take a toll on our mental health.